against cancers caused by infections. And just as a kind of repeat what I said before, we know that 21% are linked, of cancers are linked to infections, about 1% to parasitic infections, about 35% to those by Helicobacter pylori, and about 2/3 by virus infections. And I mentioned already that in the upper two cases, we do have a chance to eradicate the infectious events or the persisting infections. And but unfortunately, these patients become reinfectable after a while. Now, during the past decades, or even during the past century, as I should say, we learned that it is indeed possible to eradicate infections by vaccination. And this is clearly true for infectious agents which solely infect humans. Of course, the best example is the smallpox eradication, which worked globally. Poliomyelitis is by and large, with a few pockets which still exist, eradicated. Measles, rubella, and mumps, specifically here in the Americas, has been very successfully prevented by vaccination. In Europe, for instance, we still have too many measles cases. In the year 2011, we had 35,000 cases, and 12 of these children died. And we do not know exactly how many of them have other sequelae of this type of infection. Now, let me come to the hepatitis B virus infection and the prevention. Of course, the virus is widely spread throughout the world and persists in relatively high percentages in populations covering also this region of the world, but in particular also Southeast Asia and Eastern Asia. For hepatitis B virus, it has been possible to isolate an antigen which is produced in large excess in persistently infected persons in the peripheral blood. And this was initially purified from the blood of such carriers, and in clinical trials initiated in France,